This video has been designed to give you as much information as we can regarding your baby developing low blood sugar levels. Your baby may be at more chance of developing low blood sugars because you have pre-existing diabetes or because you have developed diabetes in pregnancy, known as gestational diabetes. If your baby was born early, or if your baby's growth has slowed down, or if you need to take beta blocker medication in pregnancy, or if your baby has been unwell at birth.
For this reason, your baby will have a series of blood tests to check their blood sugar level. This is because extremely low blood sugars, if they are not treated, can cause brain injury. However, low blood sugars, if identified quickly, can be treated and the blood sugar corrected. The blood sugar is tested by taking a heel prick blood test. This can be done while you are holding your baby in skin-to-skin contact, as this will soothe and comfort your baby. The blood test will be available immediately. The first blood test will be taken before your baby's second feed, which will be no later than 4 hours after birth. Many mothers find it is helpful to express the milk before the blood test. If you are still pregnant, you may find the video on the collecting of your colostrum before the birth of your baby helpful.
The baby's blood sugar levels may be low and you will need to feed your baby. Sometimes staff may prescribe a dose of sugar gel, and if this happens, you will still need to feed your baby. Very occasionally, babies may need to go to the neonatal unit for a glucose drip if they are unable to control their blood sugars. But most babies quickly improve, and that is the end of the problem. Staff will keep you fully updated, but please remember to ask if you have any questions or if you are unsure of anything.
You can help protect your baby from low blood sugars by keeping your baby warm. The evidence is that the best way to do this is to hold your dried baby in skin-to-skin contact as much as possible. The amazing thing is that when a mother holds her baby skin to skin, her own body temperature will change to either warm or cool her baby. Keep your baby in skin contact on your chest, covered with a blanket. If the mother is unable to hold the baby skin to skin or needs a break, then her partner is the best person to hold the baby skin to skin. Be aware not to leave the baby undressed, separated from a parent. If your baby is left in a cot, ensure they are dressed and covered with a blanket.
Remember that keeping your baby close helps you to get to know each other and recognise the signals that tell you if your baby is hungry, thirsty, or just needs a cuddle. Responding to these signals before your baby gets upset will help them to feel safe and secure. If your baby is not ready to attach at the breast, then a member of staff will show you how to hand express your colostrum. The small amounts will be perfect for your baby. In the first few days, your baby should be feeding at least every 3 hours, and you will know if these feeds are effective if your baby is sucking and swallowing. Nappies will also help you to know if your baby is effectively feeding. The amount of wet nappies will increase and your baby's poo will change from being black to gradually being yellow by day 5 of life. Baby will have at least 2 poos a day. If you are formula feeding, it's best to limit the number of people who feed your baby, as this helps your baby to feel secure and develop the attachment to his or her parents. Your midwife will talk to you about the signs that your baby has had enough milk.
Your baby will need to stay in hospital for at least 24 hours after birth, as this is the time a baby is most likely to develop low blood sugars. It is important to continue to monitor your baby's well-being. You can do this by checking your baby is warm enough by testing the back of their neck. Hands and feet can sometimes feel a bit cooler. Ensure that your baby is feeding at least 8 times in a 24-hour period. Is your baby alert and responding to you when your baby is awake? He or she will look at you and be fascinated by your voice and gestures. It should be possible to wake your sleeping baby. A sleeping baby is very relaxed, but will still have some tone and will respond to touch. If your baby feels floppy with no tone or is making strong, repeated jerky movements that don't stop when you hold your baby, this could be a sign they are unwell. Speak to a member of staff immediately and tell them what you are concerned about. A healthy baby will have pink lips and tongue, and any bluish or pale colour is not normal. Babies' breathing can be quite irregular and they may pause for a few seconds. This is normal. However, if you notice that your baby is breathing very fast, more than 60 breaths a minute for a continuous period, or seems to be struggling to breathe using very deep chest movements, or their nostrils are flaring, or making noises with each breath out, this is not normal. If you are worried about any of these things, then seek help immediately. Thanks for watching. For more information on collecting colostrum before the birth of your baby, the early days with your baby, and how to access feeding support, please visit the infant feeding web pages, which can be found by searching online for You and Your Baby Wolverhampton.